One major advantage of the digital era is quick access to information, but there's also a disadvantage because not every information out there is actually correct. Thanks to Google, now everyone can search their symptoms and make a diagnosis for themselves. Most of the search symptoms are in areas of infections like sexually transmitted infections and urinary tract infections. So if you're a Google certified doctor, please keep watching so you can learn the difference. And of course, if you still have questions, go right to the comment section. Now, the names are pretty self-explanatory. Sexually transmitted infections, or STIs, are infections that are gotten through sexual contact. Urinary tract infections are infections that can occur within the urinary tract. That's when bacteria gets into the urinary tract. And that can happen when you hold your urine for too long, or for women, when you do a number 2 and then you wipe from the back to the front. Now, the urinary tract are channels that actually involve the production of urine, transport of urine, storage, and of course, exit. So this involves the kidneys, the ureters, the bladder, and of course, the urethra. But in men, you also have prostate, which forms part of the urinary tract. Now, with STIs and UTIs, some symptoms can overlap, like dysuria, which is painful urination. You usually find that in UTIs, but you can find that in STIs like chlamydia and gonorrhea. So let's actually know what the differences are. With UTIs, you're likely to find very frequent or urgent needs to urinate, and that's usually accompanied with pressure in the lower abdomen or in the pelvic region. You would also most likely find urinary retention. So there's retaining of urine in the bladder. So even when you go to urinate or when you do urinate, you still feel like the bladder isn't completely empty. You're also most likely to find a foul-smelling urine that's dark or cloudy. Now, with STIs, one of the very common symptoms are rashes, blisters, or sores within the genitals, both in men and in women. You'd also have discharge, vaginal discharge or penile discharge. And of course, in women, they can also have pain during sex, or they can have spotting in between their periods. Now, while all of this can happen with STIs and UTIs, these symptoms are non-specific because there are so many other reasons why all these symptoms can occur. So if you're not sure, do well to see a doctor so you can prevent possible complications and then you get appropriate and proper treatment. Sadly, we're in times where people don't quite understand reproductive health because anytime we talk about infertility, most people would think, oh, it's a woman's problem. But there's so many reasons of infertility in men, or so many causes of infertility that can be attributed to men. So someone might be wondering, how do I know I have infertility issues as a man? Or doctor, how do I know I have problems with my sperm? Well, with the exception of those who already have structural issues, testicular issues, or even genetic abnormalities that can predispose them to infertility, and even those with hormonal challenge who have, problems with sustaining erection, there are no special symptoms of infertility in men. So most times people know when they're trying to conceive or have tried many times and failed. When we talk about infertility, the health of the sperm is just as crucial and important as the egg. Because for pregnancy to occur, the egg must meet the sperm and there must be a union of those two. And the conditions that make that possible is that the sperm must be in the right shape. It must move forward and in the right direction. So they have to have speed. That's when we refer to sperm cells as good swimmers. And they have to be adequate in number per ejaculation. So it definitely takes two to tango. So now, how do you improve your sperm health? There are so many factors or things that influence the quality and health of your sperm. But most of these things actually center or border around your lifestyle changes. So first and foremost, smoking. My entire life, I have never seen a silver lining with smoking. Smoking is bad for everything. It's bad for your health, and it certainly is bad for your sperm. There's been so many studies over the years, and not even one has found a positive correlation. Another culprit is alcohol. So if you're a heavy drinker, scale down, because heavy alcohol use is known to reduce sperm production. Another factor is keeping the right temperature. Sperm cells are very, very sensitive to heat. The testicles are held loosely to your scrotum just to prevent it from your own body temperature. So some of you that wear very, very tight underwear is usually not advisable. I'm not, when I see people wearing very tight fitted briefs, I'm not even just worried about the heat. I'm also worried about your blood circulation. Now, they say very tight fitting underwears can reduce sperm production, but there's no study that actually says it reduces the quality. So while it's neither here nor there and might not have a direct negative impact, it has a legitimate concern. And of course, with everything, having a healthy lifestyle is important. You have to maintain a healthy lifestyle all round. You have to eat right, maintain the right body weight, and of course, resist the urge to constantly share your reproductive organ at wish, because recurrent sexually transmitted infections is known to cause infertility in men. You should also consider avoiding lubricants. Now, this is neither here nor there, and research is still ongoing on this. But some of the products that are out there have been said to have very low pH and acidic, and therefore are harmful to your sperm cells. I know you still have questions. You know what to do. Go right to the comment section, and I'll see you again soon. Most people can't tell when they have bad breath. So if you can already smell yours and it doesn't smell good, be sure for others perceiving it, it's a knockout. So let me just tell you some quick ways to self-assess. So first, you can do the cupping method, and you put your hand over your mouth like this, and then you blow a puff of air, and you can almost immediately smell it. You can also lick the inside of your wrist here. You wait a few seconds for the saliva to dry off, and then you smell. Or you can use your floss in and around your teeth and then smell. Yeah, it all sounds a little gross, but having bad breath and not knowing that you do is even worse. But I think the safest method is actually to just ask the truth blatantly from a loved one. Bad breath can be temporary, like when you wake up in the morning, or when you eat foods and spices with very strong odors, like garlic, curry, onions, and of course, for people who chew or smoke tobacco. One key thing to note about bad breath is saliva production, because saliva production helps to keep the mouth moist, because a dry mouth causes bad breath. And that's why we wake up with a bad breath in the morning, because at night, the production of saliva is reduced. So let's talk solutions. Most of the food that we eat actually cause bad breath because they release sulfur. And that's why I would always recommend that you incorporate foods that actually help to increase saliva production, like apples, carrots, celery. For those of you who have reflux, over time, the backflow of food or the flow of your stomach contents back into your mouth will cause a bad taste and eventually a bad smell. So do well to get that treated. And for those of you who smoke, I'm sure you know about smoker's breath, because tobacco already has a very peculiar smell. Now add that to the dry mouth you get from breathing in very hot air. So you already know what the solution is. However, most cases of halitosis actually stem from diseases of the mouth, like holes in the tooth or gum disease. That's why dentists recommend that you floss daily, you brush your teeth at least twice a day for at least 2 minutes. Some recommend with a fluoride toothpaste. And while brushing, also brush your tongue and your cheeks, because some studies have shown that helps to reduce the bacterial load. And of course, do your regular dental checks. And if it's been 3 months or over, I'm pretty sure you didn't exchange files with your toothbrush. You can let it go. Change it. See you in my next video. Sadly, we're in times where people don't quite understand reproductive health, because anytime we talk about infertility, most people would think, oh, it's a woman's problem. But there's so many reasons of infertility in men, or so many causes of infertility that can be attributed to men. So someone might be wondering, how do I know I have infertility issues as a man? Or doctor, how do I know I have problems with my sperm? Well, with the exception of those who already have structural issues, testicular issues, or even genetic abnormalities that can predispose them to infertility, and even those with hormonal challenge who have, problems with sustaining erection, there are no special symptoms of infertility in men. So most times people know when they're trying to conceive or have tried many times and failed. When we talk about infertility, the health of the sperm is just as crucial and important as the egg. Because for pregnancy to occur, the egg must meet the sperm and there must be a union of those two. And the conditions that make that possible is that the sperm must be in the right shape, it must move forward and in the right direction, so they have to have speed. That's when we refer to sperm cells as good swimmers. And they have to be adequate in number per ejaculation. So it definitely takes two to tango. So now, how do you improve your sperm health? There are so many factors or things that influence the quality and health of your sperm. But most of these things actually center or border around your lifestyle changes. So, first and foremost, smoking. My entire life, I have never seen the silver lining with smoking. Smoking is bad for everything. It's bad for your health, and it certainly is bad for your sperm. There's been so many studies over the years, and not even one has found a positive correlation. Another culprit is alcohol. So if you're a heavy drinker, scale down because heavy alcohol use is known to reduce sperm production. Another factor is keeping the right temperature. Sperm cells are very, very sensitive to heat. The testicles are held loosely to your scrotum just to prevent it from your own body temperature. So some of you that wear very, very tight underwear is usually not advisable. When I see people wearing very tight fitted briefs, I'm not even just worried about the heat. I'm also worried about your blood circulation. Now, they say very tight fitting underwears can reduce sperm production, but there's no study that actually says it reduces the quality. So while it's neither here nor there and might not have a direct negative impact, it has a legitimate concern. And of course, with everything, having a healthy lifestyle is important. You have to maintain a healthy lifestyle all around. You have to eat right, maintain the right body weight, and of course, resist the urge to constantly share your reproductive organ at wish because recurrent sexually transmitted infections is known to cause infertility in men. You should also consider avoiding lubricants. Now, this is neither here nor there, and research is still ongoing on this. But, some of the products that are out there have been said to have very low pH and acidic and therefore are harmful to your sperm cells. I know you still have questions. You know what to do. Go right to the comment section and I'll see you again soon. This is something that has trailed me nearly my entire adult life. I've had problem falling asleep and staying asleep, what we medically call insomnia. So it's not even about being a doctor. My personal experiences makes me well equipped to be able to talk about this with you guys. So I'll share some tips that has helped me over the years. Hopefully it helps you too. Also, some people have reached out to me on issues they would like me to talk about. And if you're watching and you also have some medical concerns you'd like me to shed some light on, just go right to the comment section and I'll get to it. Some will also still be wondering, okay, yes, I have trouble sleeping, but how am I sure it's insomnia? Well, if it is insomnia, there's some daytime effects that you'll likely experience. Sleepiness during the day, extreme tiredness, difficulty concentrating, you're irritable, that's you're easily irritated or annoyed. And no, I'm not talking about those of you who inherited your anger problems or have unexplained anger issues. That has nothing to do with your sleep problems. You need to see a psychiatrist. But anyway, just that general feeling of not being well rested. One thing that's worked for me consistently over the years is taking warm tea at night with milk. I know most people just don't like milk or they're lactose intolerant. Well, either way, you can just take tea, preferably chamomile tea because it's more soothing. Also, eating healthy because healthy body, healthy mind, better sleep. For those of you who music is your kryptonite, some people have said it has a calming effect, so it helps them sleep better. Exercise. My now late dad, God bless him, used to be so worried, I would almost even say fascinated by the idea that I was almost always awake. So he would just Google up stuff and then just suggest them to me, and I would indulge him every now and again. One of those things was taking long walks early in the morning and early evenings, just back and forth around the house. And initially we used to do it together and then I started doing it alone. I would say that was something that significantly helped my sleep. Some people would say, okay, I've tried all these remedies and it still didn't work. Well, those are the people that would require medical intervention, like the use of medications, of course. So when you do go to see a doctor regarding your sleep issues or sleep disorder, sleep doctors are usually in the areas of psychiatry and neurologists. They would first take a proper history to ascertain the cause of the sleep issue. So they would probably ask you questions about your sleep-wake patterns, your sleeping, if you have abnormal sleeping conditions like excessive noise around you, poor light regulation, so your TV is constantly on or you're using your phone at night, or extremes of temperature, very hot or very cold. They would also ask you if there was a change in your sleeping schedule, like if you traveled somewhere new and probably it's an unfamiliar environment and you can't sleep. Those are the questions they will probably use to assess. But then there's another category of people who, even when well rested, still complain of sleepiness. So they're always sleepy. One of the ways to assess such people is using the Epworth sleepiness scale. So those are just parameters to score the severity of the patient's symptoms. So it could be mild, moderate, or severe. But a score above 16 says you're dangerously sleepy. So that puts you at risk and others around you. And that's why I'm constantly emphasizing on the need to have these things checked so that you get the right course of treatment and you protect not just yourself, but others around you. So I was told a story about a woman who recently lost her 3 weeks old baby to unexplained reasons. And it was very disheartening to hear because pregnancy isn't particularly a very easy process. In addition to childbirth, it must have been really traumatizing for her to lose her baby so early. And that's what brings me to today's topic. SIDS, sudden infant death syndrome, is actually just unexplained sudden death in a baby under or in children under the age of 1. Now, in some parts of the world where they have very strong religious beliefs, most cases of SIDS could or would be attributed to spiritual causes. While those things occur and cannot be trampled on, in medicine, we also have a lot of theories and hypotheses. One of those theories is that there are factors that actually increases the chances of sudden death in an infant. One of those factors is being born prematurely or being born with a brain defect. In some of those children, there is a possibility that the parts of their brain that regulate breathing and waking is not fully developed. Another factor is exposure to secondhand smoke. So if you do smoke cigarettes or you live with a partner or family members who smoke, it's actually very dangerous for babies. Babies are delicate and so are their organs. So exposure to smoke or secondhand smoke, it's likely that they're not going to survive the effects. Of course, family history. Once there's a positive family history of a medical issue or an ailment, the likelihood of reoccurrence is very high. There's been a lot of research on SIDS. There's still a lot of ongoing research on SIDS, but there's yet to be a very tentative or definitive cause. However, some of the research has provided a template for prevention. What are these prevention tips? So first, do not put your babies to sleep on their tummy. It increases the chances of suffocating. It is advisable to put them to sleep on their back. If you do have to put them to sleep on their tummies or on their side, please do it supervised, especially in the early stages of their development, at least until they're able to roll from side to side. Do not cover their heads when they sleep. I know some people or some mothers are very fretty about very cold weather, so they tend to make the room unnecessarily hot. That's also not advisable. And most importantly, please resist the urge to sleep with your babies glued to you. This is a very controversial area because most people say co-sleeping or bed sharing helps the child emotionally or helps the mother and child to bond emotionally. So a lot of people are for it and some people are against it. However, bed sharing, whether with the parent or with a sibling, has a risk of overlying because you're sleeping in very close proximity to the child. So it's easy for you to close their mouth or their nose or just, obstruct their airway. And of course, that can result in death. In summary, just practice safe sleep environment. Make sure to share. This might help someone. Last week, I came across a video on social media where a mother posted a video of her son who has Down syndrome, a developmental disorder. And one of the comments in the comment section insinuated that the mother should have terminated the child when he was still a fetus. Now, while that comment greatly offended me, it also made me realize that there's very minimal awareness on so many disease conditions and people living with disability. The statistics from World Health Organization says 1.3 billion people around the world. That's 1 in 6 of us have experienced some form of disability or are living with disabilities. That's a huge number. So that means everyone around you has someone, a loved one, a relative, a friend, somebody who's living or have experienced some form of disability. Disability is not only physical, it's any impairment that causes a restriction or places a limitation on you physically, mentally, or even intellectually. In some parts of the world, like Asia and Africa, the stigma of living with a disability is almost always oppressive. And that's why I thought it was important for me to just run through some coping mechanisms for people living with disabilities. First and foremost, understand your disability, understand your condition. Knowledge is power. Know your condition, learn the progress, know the outcomes. The more you know, the better you can cope. Another way to cope is to accept help. There are so many assisted devices or tools that are designed to make your life easier, like for those with limb disparity who have one leg shorter than the other, regardless of the cause, whether it was caused by polio or an accident or you were born with it. Those will require walking aids. Embrace the help. You're more than these devices. They're only a means to an end. They don't define you. Learn to live in the moment. Most of the time, you're so focused on the disability that you completely neglect the rest of your life or the remaining parts of your life. Make a mental note or take time to list out all your strengths and focus on those things that you're actually good at. So there's very minimal time to focus on your weaknesses or the limitations that you have. The fourth one, I cannot stress enough. Keep your support system close. Now, you don't need to have any form of disability to require a support system, whether it's emotionally, financially, or even physically. We all need a support system. But for those of you who live with disabilities, it helps to have people who understand your specific needs because it can significantly help you in coping with your conditions. Another way to cope with living with a disability is to avoid self-pity. It's like a magnet for depression. So engage in your favorite hobbies. Read a book, go to the movies, take a walk, learn a skill or two, or you can even improve on an already existing skill. Just find what you love to do and do it consistently and passionately. It helps to fight away the loneliness and also makes you feel fulfilled. There are several cultural and religious beliefs across the world. And in my experience, having a very strong belief system also helps you to just generally cope through life. So whatever that belief system is to you, hold on to it. It also helps to give you a sense of renewed hope. Lastly, and most importantly, seek professional help. Everything I've said is just a way for you to be able to cope generally. But it's very important for you to find a professional that is tailored to your needs. So you can speak to a licensed therapist or a psychologist, a professional who understands your condition, and of course, can provide or recommend strategies that are specific to your disability. Hypertension is one of the leading causes of death worldwide. So chances are you or someone you know could or have already lost someone to complications of hypertension. Our roles as professionals is to educate you, but some of your choices can predispose you or increase your risk of developing hypertension. So keep watching so you learn some of those choices. And if you have medical questions or concern, just leave a comment. Top of those choices is our food choice, especially a diet that is very high in salt and low in potassium. Salt causes your body to retain water, and that will increase your blood volume, ultimately increasing the pressure. Number 2, cholesterol. Your fried foods, your red meat, your butter, baked goods, sweets. All these are foods that have high fat content. And what happens is, over time, they deposit in the walls of the vessels that supply blood to the heart. And that will put a strain on the heart, ultimately increasing the blood pressure. Number 3, alcohol. Alcohol is a major culprit for hypertension. Let me put it plainly so you understand. It increases the hormone in the body called renin that narrows the channels through which blood flows to the heart. And that hormone also regulates the fluid in the body. So imagine this, very narrow channels and a huge volume of water. Obviously, that will cause an increase in pressure. Number 4, a sedentary lifestyle, where there's minimal to no physical activity, leading to weight gain. And obesity is a major risk factor for developing hypertension. So for those of you who work long hours, it's advisable that you take walks during your breaks. And those of you who have to go to the office, sometimes you can take the stairs instead of the lifts. This will not only reduce your chances of developing hypertension, it will also improve your blood circulation. While some of these unhealthy choices increase our risks, some other factors are not within our power to change, like age. Blood pressure tends to increase with age, especially for those over 60. Genetics. If there's a positive family history of hypertension, the likelihood of you getting hypertension is high. Race. Hypertension is commoner among blacks, so you likely find it within black Africans or black Americans than you would in white or Hispanics. Gender. Men are more likely to develop hypertension than women, but over the years, some results have varied. Socioeconomic factors like your job, your income, generally your status in life. All those are things that can increase stressors, ultimately increasing blood pressure. And of course, lastly, comorbidities like diabetes. So for those of you who already have an existing health conditions, one of the complications of diabetes is damage to the blood vessels, and ultimately that will lead to increase in blood pressure. I'll tell you for free, one very sure and quick way to actually save your life is to always take your bath. Yes. Now let's talk good hygiene practices. There are multiple personal hygiene practices, and it always almost sums up to keep your nails short and trim, wear clean clothes, wash your hands. But today I want to re-emphasize on my golden rule of personal hygiene: regular bath. I've heard some people say in the past, oh, I don't really go out, or I work remotely, so I don't have to shower every day. I shower 2 to 3 days. And I've really never understood that. I've actually kind of pondered over it. And I've thought to myself, maybe there are other reasons why they don't want to take their bath every day. Probably because they're trying to conserve water, or some kind of cultural belief, or they have a phobia for water. Regardless of your reason, the smell doesn't wait 2 to 3 days, because we have millions of sweat glands all over our body. And while sweat helps to control our body temperature, it is also a breeding ground for bacteria. So sweat doesn't have an odor, but then the bacteria breaks down the sweat to produce the odor, especially in areas of our body like the genitals and the armpits or underarm, where we tend to accumulate more sweat. So the increased sweat means an increased tendency to smell. Now, for some people, having a regular bath and doing it right is ideal, and they don't require extra effort. While for some, they do have their baths regularly, but they don't do it properly. So they require aids like the use of deodorant or the use of antiperspirant. And if you're an advocate for I only use natural products, you can also just stick to water. And if you do it right, it should suffice. I know a lot of people might trivialize what I'm saying, but having a poor personal hygiene can actually have a very negative impact on your life. Because on a social level, when people identify you as somebody who smells or has an unpleasant smell, they tend to avoid you. So that can cause isolation, and isolation fosters loneliness. Loneliness fosters depression. So if you're still watching me sitting on your couch and counting to your day 3, do this. Get up, take a few steps towards the direction of your bathroom, and take a bath. Hey, so here's the question. Have you ever experienced something or seen something that you were never able to forget, regardless of how much time passes? Let me give you guys a little short story. So back in uni, my sister and I were invited to this house party by a friend of ours. It was a really nice party, so it kind of lasted into the wee hours. And then somewhere along the line, we heard a very loud noise. Now, I'm saying very loud noise because we could hear the noise despite the already loud noise that were coming out from the speakers. So I was curious. I went looking for the source of the noise, and I opened one of the rooms and found a guy sleeping and snoring. But here's the thing. It wasn't just the snoring. There were intervals of interrupted breathing. I was never able to forget that. And this was way before I ever conceived the thought of being a doctor. But I always still wondered if there was a medical correlation to that. Fast forward to the present, well, I do know there is a sleep apnea. And in that case, obstructive sleep apnea. Now, I know clearly it was a problem of weight because the guy was morbidly obese. But then there are several reasons why obstructive sleep apnea can occur in people who are not even obese, and even in children. Now, you know, anything that can interrupt your breathing is potentially fatal. So please take this seriously. Now, this is not to say everyone who snores or snores loudly has a problem or have obstructive sleep apnea. So then you ask, what do you look out for? So first, you look out for the loud snoring. I know everybody who say they know somebody who snores. We all snore. Well, not all of us, but most people do. But experiencing that made me realize that snoring is in degrees. You also want to look out for the pauses in their breathing when they sleep. Those pauses will cause their sleep to be disrupted. So you'd also notice that they're abnormally sleepy during the day. Obstruction clearly means that there's something clearly in the way. So it could also be caused by excess tissue in structures that lie between the head and the neck. A clear example of obstructive sleep apnea, especially in children, is what we call adenotonsillar hypertrophy, which is an enlargement of the tonsils and the adenoids. Treatment is clearly dependent on cost. For obese individuals like that guy or any other person who's overweight, the clear solution is a no-brainer: weight loss. But the most common treatment is what we call continuous positive airway pressure. I know it sounds like a lot of big words, but just really think about it this way. It's a machine that supplies pressurized air through a mask. So it comes in different sizes and obviously preference. But the essence of the machine is to keep the airway open so that the breathing is stabilized. Other not very common options are dental devices, nerve stimulation, but in severe cases or cases of chronic airway obstruction, upper airway surgery would be considered. Malaria is a tropical disease, so of course you only expect to find it in certain countries or regions. And most people know it's caused by mosquitoes, which are parasites. But with treatment, just like you would any other disease, the aim of treatment as a doctor is to help or ensure that you save the life of your patient. But where that treatment is not effective, we say there's treatment failure. But the goal of treatment in malaria is to reduce the parasite level in the blood to zero or to a very insignificant or minute level where the body can just fight it off. So today I'll be sharing with you some reasons why treatment failure can occur in malaria. Firstly, drug resistance. So you've given the patient the right drug at the right time in the right dosage, but the patient is not feeling better or getting better. That's mostly because the parasite is resistant to the medication that you've given, which means the parasite has the ability to still survive in the system and replicate despite absorbing the medication. A classic example of that is chloroquine. It's a widely used drug in the treatment of malaria, but over the years, we've seen so many chloroquine resistance. This is partly probably due to routine exposure, but some studies have also shown that there's something in the genetic makeup of the parasite that makes it less sensitive to chloroquine. And that's why I always strongly advise against self-medication, because when you're given medication by a doctor or a physician and you encounter a problem, usually an alternative is provided or another medication is added to obviously improve the efficacy or the effectiveness of the chloroquine. Another reason why the treatment for malaria wouldn't work is wrong diagnosis given to you by a professional at the hospital, or of course, it could be an assumption on your end or a self-diagnosis. The hallmark symptom of malaria is fever, which can be found in anything and everything because it's just your body's response to stress. I'll give you an example. Somebody who hasn't worked out in years suddenly starts going to the gym every day frequently. You realize that sometimes you now start feeling ill. It's not necessarily because there's an ailment or there's an infection. It's because there's a stressor. So other symptoms that you find in malaria like weakness, loss of appetite, joint pain, fatigue, just that general feeling of being unwell. It's not different from symptoms that you would find in any other illness with fever. When the treatment is ineffective, sometimes it could be because you don't actually have malaria. That's why it's always advisable to get tested before you get treated. Another reason why treatment in malaria can be ineffective is poor compliance or inappropriate dosage. So those of you who never finish your medication, this is for you. Inconsistency with medication can significantly affect your treatment outcome because taking your medications on schedule ensures that you have adequate blood concentration of the medication to actually effect a change. And of course, we can't rule out one of the most obvious reasons, poor drug quality, which is the reason why we have drug regulation bodies. Typically, men over the age of 50 are mostly bothered about one thing medically, prostrate, because some of the common issues that they experience as they get older centers around the prostate. Top of that list, benign prostate hyperplasia, BPH. And then there's prostatitis, which is inflammation of the prostate, usually from infective causes. And of course, the big one, prostate cancer, which is known to have a much higher occurrence in people of Black and African descent. So today I want to focus on benign prostate hyperplasia. And for the purpose of this video, I'm going to be using the terms BPH and enlarged prostate interchangeably so it sticks better. If you've been following my channel, you know I'd previously mentioned that the prostate forms part of the urinary tract in men. And for reasons not crystal clear, the cells in the prostate increase in number, and that causes an enlargement of the prostate. This enlargement now pushes against the bladder and the urethra, obviously causing an obstruction. So the symptoms that you likely experience would be the urgent need to urinate and an increased frequency to urinate, especially at night. You could also experience dysuria, which is painful urination. You could have a weak or poor stream of urine, which means that the urine flow is not continuous. You could also have dribbling, which is the droplets or trickles of urine after you're done urinating. Of course, this lutein urine over time can cause a lot of complications, which can involve bladder stones. It can also cause infection, recurrent UTIs, because it's causing the stasis within the tract. And it can also cause damage to the kidneys. Also, the backup will lead to pressure, which can damage the kidneys. The progression of BPH is different from individual to individual, meaning that the symptoms may or may not worsen over time. It's not cast in stone. So the decision to have treatment is completely dependent on the severity of your symptoms. For mild symptoms, they can be overlooked. For moderate symptoms, the decision is usually considered on a benefit over risk basis. And of course, when the symptoms are severe, treatment is inevitable. There are many treatment options available to treat BPH. The treatment options involve medications, some that help to relax the muscles of the bladder and the prostate for easier flow. There are some that can also reduce the size of the prostate to relieve the obstruction. You also have surgical procedures, too numerous to mention, depending on the severity of symptoms that you present with. So if you're over 50, have a history of BPH, or someone in your family has BPH, you're having recurrent UTIs, or you're not even sure if there's anything wrong with your prostate, or even if you're experiencing any of the symptoms that I've just mentioned, book an appointment with your urologist and get started.